Welcome everyone. Thanks for coming along today. My name's Sue Scull and I run the Research Education Program here at CAHS, and over the course of the year we deliver about 24 seminars that all touch on different aspects of the research process, and all of them are an hour of power. So in just 1 hour we try and cover a huge topic and give you a general overview. We obviously can't cover everything in an hour, but we put a lot of effort into our handouts. So you'll notice that they don't just contain the PowerPoint slides, they are there, but there's also a lot of other information that you might find helpful, and also other training opportunities if there are related training opportunities. We'll put those in as well. All our sessions are linked all around Western Australia, so we ask that you hold your questions to the end so that everyone can hear them with the benefit of a microphone. And also please provide us with some feedback at the end. We've got hard copies here in the lecture theatre, and if you're out there online, we have an email survey that we'll send to you afterwards if you've registered, and we really do take on board your feedback, so please be honest and we'll try and improve what we do for next time round. And of course, just to let you know that on our website we keep a complete set of all our seminars throughout the year, both the recordings and the handouts. If you've missed something or want to revisit something, it's always there. Right, so this is another big topic, grant applications and finding funding, and obviously there's lots of different types of grant applications, so we're going to approach this in a general way and try and provide you with some practical advice that will help you shape applications and know what people are looking for, and hopefully have a greater chance of success. So today we're going to talk about looking for grant opportunities, and then a bit around the application review process, because I think it's really helpful to know who's on the panel and what they're looking for, and those are sort of general issues that we can cover in a forum like this. And then some general application planning stuff, and then drill down into all the specific headings, the sorts of things that most applications would ask for, and then talk a little bit about the submission process and the response processes. All right, so finding funding, I think this is something we get asked about a lot, and the bottom line is it's really hard. So all researchers basically have to find their own funding. It's never just going to land in your lap. So knowing where to look and find out about the different opportunities is really important, and it's especially hard if you're a busy clinical person trying to fit research around the edges. But the bottom line is there are lots of opportunities out there, and I'm going to cover the sorts of places that you can look and sign up for. And obviously if you work in a research institute, it's much easier because there'll be people employed to scan for all of these things constantly and then publicise them. But a lot of the health service providers do that too, and we do that now here at CAHS really well, and that's really ramped up over the last year or so. And I think the other really important point here is that collaboration is everything. No matter how small your project is, you're going to have a much greater chance of getting funding if you've got a strong team, and it'll give you greater access to resources and other funding opportunities, and you're much more likely to get through if you've got a good collaborative network working together. So one of the most important things is that all funding agencies are different, and it's really important to make sure that you've got a good fit with the agency you're applying to. So they'll all have different priorities and different outcomes that they're looking for. So it might be that they're only interested in child health, or only interested in heart research, or they're only interested in people who work full-time for them already. It depends what it is. So not only does your research question have to fit the funding agency, but you personally need to fit the funding agency. So eligibility might range from you need to be at least half-time, and you need to be employed, the principal investigator needs to be employed by that organisation if it's a health funding grant, for example. And then if all of the above is true and you think you are eligible, then make sure your application meets every single requirement and you've read every single line, because they're looking for reasons to screen you out early on. So make it as good as you can. So these are some of the types of funding opportunities. There's lots of other ones as well, but right up the top for us here in Australia would be the National Health and Medical Research Council or Australian Research Council project grants, and those are really hard to get, very competitive. About 22% of applications are successful, even with the huge amount of work people put in. Most of the hospitals have foundations that raise money and award money for research, and that can be from little seeding grants for pilot projects or equipment right through to quite large studies done over several years. Then there's the WA Child Health Research Fund, and then the Health Department itself sponsors a whole range of things that helps free up busy clinical time, like the Clinician and Registrar Fellowships, which buys some of your time to do research. And reasonably recently added is the new Independent Researcher Infrastructure Support Award. So those are for researchers that might not have a strong enough track record yet, for example, to be leading an NHMRC grant, and they might have missed out there, but they might well get a foot in the door for these ones. WA Health also has specific priority areas, and research translation grants often target those. And then, of course, there's the Medical and Health Research Infrastructure Fund, which is opening up more possibilities as well. Universities are going to have access to different types of funding again, as are research institutes. And then there's loads of private organisations as well. So recently in paediatrics, we now have the Stan Perrin Charitable Foundation, so that's for child health research specifically. And then there are others that you will have heard of, like the Cancer Council or the Heart Foundation, that will obviously have their own specific areas of interest. So a lot of the websites related and information related to these are in your handouts, but just to give you a broad overview of the sorts of things that are out there, and there are a lot. So here within WA Health, what was the Research Development Unit is now called the Research Innovation Office, and they regularly put out bulletins about funding opportunities, and their website is in your handout, and you can register to be on that mailing list and get regular updates. Similarly, here at the Child and Adolescent Health Service, we've got the CAHS Research Newsletter, which comes out every month now, so that's been happening for about the last year. And we also now have a weekly funding newsletter, so you definitely want to sign up for that one. And our CAHS Research Coordinator helps get that out, and she's also a fantastic port of call if you've got questions or need a bit of help around grants. You can make appointments to see her. That's Angela Fonseca, and details are in your handout. Of course, there's also the PCH Foundation grants, so that's an example of a hospital foundation which provides all sorts of funding opportunities from small to large on an annual basis. If you work at Telethon Kids Institute, or you're collaborating with them, or you have an adjunct appointment there, you'll also be able to sign up for their weekly bulletins as well, and those are excellent. So they're a well-resourced research institute, and they've got people whose job it is to do this every week. And then, just as one example of one of the universities, UWA has their research grants office, and even just within one faculty, there are newsletters, there is direct support within the divisions, there are people allocated to help with grant applications, and then of course there's grant administrators who can help you with some of the nitty-gritty, and there's also training available. So most of the universities will have things along that line, and if you've got an adjunct position, you're eligible to use all of those options as well. So as I said, most of the hospitals around town, both public and private, will have foundations that you can apply to, and fairly commonly you'll need to have the Chief Investigator as an employee there in some way. I've put the links in your handouts to all of these different hospital foundations, and it's really worth having a look to see whether they've got things that you might want to apply for. I'd also really encourage you to sign up for Grant Connect, which is an Australian government information hub all about grant funding in research, and the Community of Science is another one, and that goes way beyond Australia, so that's not only national but international funding opportunities. And Grant Search is another Australian one, but it again goes way beyond health. So that's all types of funding. So that can be fairly overwhelming, but you can sign up and then specifically search on the sort of area that you might be working in. And then, of course, if you're planning to do an NHMRC application, then you should definitely sign up for the NHMRC tracker. So they will give you regular bulletins via email about where you need to be up to and what the next process is, and announcements about funding and all of those things. So there's lots of places you can get onto an email listing so that you can be kept up to date. And then there's still more you can do. So definitely talk to people who've been successful with grants in the past and ask them what their tips are. What was it that gave them a winning edge, and have a look at their applications. Most people are very willing to show you. As I said, look at university sites and subscribe to these alerts for various funding agencies. So not just those national ones, but maybe the private organisations as well. And a really important thing to do is, if you've found one that you think might be a good fit, is don't just read the instructions for applying, but also have a look at their strategic plans and their policy papers and things like that, so you understand what their priorities are and what, again, might give you a bit of a winning edge if you can align your outcomes with what they want. And we've talked about updates for Australian competitive grants. So sign up, sign up, sign up. Okay, so it's good to talk about the application review process at the start of this talk or early on in this talk, because I think unless you know the sorts of people that are going to be on a panel and what they're looking for, it makes everything else hard to pin down. And yes, it's also a good time to point out that your application really does need to be a joy to read, and I'll keep coming back to that. So not only does it need to be succinct and objective and in a logical order, but it also needs to be beautifully written. And if you want to find out more about good scientific writing, come along to our scientific writing seminar or have a look at it on our website. But it really is important, because you don't want to be distracting them with bad grammar and lots of annoying things. So it's really, really important to, what I like to call, get to first base. And obviously every grant application is different depending on the agency. But increasingly what's happening is there are so many people trying to get funding that a lot will get screened out very early. So increasingly funding agencies are calling for what are called preliminary research proposals or letters of intent. So they're very short and they need to be brilliantly written. It's actually incredibly important. And they're looking for any reason to cut you out. So don't make it easy for reviewers to get rid of you on the first pass, because only a proportion of the applications are going to make it through stage one. So the idea is that you've got no obvious faults. So what I like to think of the big things are what I've mentioned already, the fit with the agency. So if you're not eligible or your question is of no interest to them, then don't go there. And make sure you complete all the sections and get all the signatures. That sounds really obvious, but sometimes grant applications can be quite repetitive, and you might find that you feel like you've just provided a justification through describing the impact that it's going to have and the knowledge gap that you're going to fill, but then they ask you about significance under a different heading, or there's a background section and you feel like you've got to go over it again. But never just write C section whatever, because they're not going to do that. And signatures are frequently missing, and if there's one missing, it won't get looked at. Similarly, if you've gone over the page limit or put all the critical information into appendices that aren't allowed, then that's a problem, because they're not going to see it and they won't look at it. And then all the little things. So we don't want typos, we don't want budget mistakes. We really need to think, if there aren't headings provided, and often there are, but if there aren't specific headings provided, provide ones that are really catchy and in a logical order that draw people's attention to the important pieces of information. And do stick to the font and the font size that they say. So if they say 8 pages of 12 font times New Roman, don't do something else to fit more in. It needs to be succinct and pithy, and they won't look at it if you've broken the rules. Similarly, sticking to the page limits, they'll only read up to where they've said, or they'll put it in the no pile. And it is useful, given how much information we often want to put in, to think about using images and charts or diagrams, because a picture can tell 1,000 words if done well, and visually it can be more easy to process a lot of information, particularly for things like timelines and so on. Okay, so it's really important to understand the panel composition. So by and large, people on review panels are not paid to be on review panels. They're volunteers, they've been carefully selected, but they're often reviewing grants in less than ideal circumstances. So at night, on weekends, after hours, on holidays, on the bus, or even on the way to the panel review meeting, worst case scenario. And it's frequent that people on the panel are not experts in your field. They might be a generalist, for example, they might be a clinician of some kind, but they might not know anything about your area. And in addition, there may be others on the panel who are lay people, community advocates, industry representatives who literally know nothing about your area. So it's very important that you write accordingly, because if you bombard people with far too much detail using acronyms and abbreviations and things you're very familiar with, you may have already lost most of them. So do think about keeping it as simple as you can while still remaining scientific and objective and logical. And whilst it's true that all panel members will generally have equal weight, they'll usually appoint a primary spokesperson or chief spokesperson who may be the only person who's read your whole grant. So this is why the summary section is just critical. So the rest of the panel might have just read a couple of paragraphs. So that summary is really important. The chief spokesperson might, for example, be allowed 10 minutes to describe your project, and it's quite possible they're not an expert in your field, so please remember that. And if they're underwhelmed by your proposal, then nobody else is going to run with it either. So you just have to assume that your main pitch might be going to one person primarily. And then what happens is the whole panel, having listened to that, will have a discussion and they'll rank all the projects that have applied in order of merit. And then they'll usually jointly discuss the budgets and then decide how many projects they can fund with the amount of money they've got, and they'll often chop a lot of money out of people's budgets as well. Sometimes they will seek responses, or they might seek responses from you to particular questions. That doesn't happen very often, but sometimes people are very interested in the project, but there's some vital piece of information that isn't clear, and they may want to contact you. So it's good to be around and available. And in terms of assessment criteria, again, obviously it varies from funding agency to funding agency, so understand what their priorities are. Scientific merit is a biggie, and if you don't overcome that hurdle, then you probably won't get any further, but they're obviously interested in impact on future practice, impact on community health or individual health. They're very interested in research team track record. And then other things may come up as important headings too. So community involvement in the project. Are there going to be economic benefits? Which often isn't the case, but if there are, you should certainly mention them. Is there a good collaboration with other areas? Is the budget appropriate and justifiable? And is there a clear knowledge translation plan? And there might be lots of other things as well. We're going to talk about some of these in a bit more detail. So there's lots of ways of looking at impact, but obviously we're hoping to generate new data, but new data of itself is not enough. Just because it's novel doesn't make it good. So it needs to be novel and important. And so understanding what makes an important research question is really fundamental, which is covered in our Research Fundamentals seminar. But it's things like it's either a common problem or a severe problem. There's a clear knowledge gap that you can fill, and it's going to have an impact on the things listed here. So working out what's going to fit with the agency and emphasising why it's important is really essential. Let's keep going. And putting together a strong team. So this will come up a few times because it sometimes appears in different sections of grants. But obviously it depends on the scope of the project. If you're just doing a little survey, you don't need a massive cast of thousands. But in general, it's really important to be inclusive and collaborative rather than exclusive and work by yourself. You should never work by yourself. Your project will only get better in quality and more likely to succeed if you include all the relevant people. So, of course, you want content experts, but you might also, for large projects, particularly want to consider having a statistician or an epidemiologist on your team. That convinces people if the methods are all very appropriate. And you might need a project manager for projects that go for 2 or 3 years and have lots of staff, or a data manager who can help with all the security and database building and so on. And you almost certainly are going to need a community representative on a larger project, or even in the development phase of a small project. It's advisable now. Many agencies are looking for that, and they don't want to just see a box tick. I showed it to someone the night before. That's not the same thing as community involvement. Cultural advisors, depending on the communities you're working with. If it's really a big project, you might want to get comms involved, depending on where you work. And it's always a good idea to get policymakers involved if that's the aim of your project, is to create data that might change policy or practice. So with regard to investigator track records, certainly for NHMRC, they're interested in very particular things. But in general, I think it's similar across all funding applications, that you need to show that your team demonstrates collaboration, even if it's just between departments or ideally between different health service provider settings or interstate or overseas. You need to show that you've got enough expertise in the group that it's feasible to complete the project as written. And each person needs to have high levels of relevant productivity. So you might have someone with 100 research papers, but none of them have anything to do with the topic that you're applying for funding for. So that wouldn't be as strong as someone who had 20 highly cited, really in big impact factor journal papers written on a relevant subject. And you would put your investigators in rank order of their CV, their track records. And it's actually important not to put people on there that will be seen to drag down the overall team, which sounds horrible, but that's how NHMRC certainly look at it. And it doesn't mean that those people can't go on, but they would need to be lower down. And often they're interested in papers in the last 5 years, for example. So if you've got someone who's done loads of research but for whatever reason has needed to take time out because they've been doing setting up a training program or taking time out for maternity leave or whatever it is, you need to describe that interruption, because they'll look at what you've produced relative to the opportunity you've had to work in the area. So don't be shy in writing those things down. And then depending on where you're applying, they may be interested in all of these things as well. So we do have to blow our own trumpets a bit. And this is just a list of some of the things that you might include, and sometimes they ask them and sometimes they don't. But obviously publications, as well as the impact factors and number of citations per paper, depending on where you're submitting. And just be aware of, sometimes they do say the last X years, so don't put in things that aren't applicable. And obviously the area of research is important, that the different investigators have worked in, whether you've had previous grants, committee memberships, whether you've got experience with community engagement or community involvement in research, whether you've won prizes, supervised PhD and master's students, developed programs, policies, courses, or intellectual property. So all of those things can bump you up a little bit. And you will generally be asked what time proportion each investigator has to give to the project you're applying for funding for. And it can be a tricky thing, particularly for the chief investigator. So if you put down that the chief investigator has 70% of their time available for this project, that might ring alarm bells in the sense that they haven't got enough to do, they're not actively involved in research. don't have a track record, versus the chief investigator only has 5% of their time to spend. Well, can they really take on that role of taking responsibility and overseeing the entire project? Maybe not. So that balance can be tricky, so you might want to get some advice around that. And then for international investigators, that can be showing great collaboration, but if they don't really have a proper role, some funding agencies will look at that as waste of funding or leakage of funds to outside Australia or whatever. I mean, we'd like to think that wouldn't happen, but I think that does sometimes happen. So be very clear about what their role is. All right, some general stuff. Time planning is paramount. So it's great if you know how to use a Gantt chart, or there are project management software applications out there that can be really helpful, and if you've got a program manager, they'll do all that for you. But in smaller projects, you really just need to be able to graphically demonstrate when you're going to do things and how all the different tasks are going to overlap, and set yourself realistic timelines. So in terms of preparing for a funding application, unless you're a super experienced researcher with a massive track record and you've done it loads of times before, you would never leave it less than 3 months to put in for a funding application, and most people early on in their careers would work up something over 6 to 12 months more realistically. And if you think about all the steps that are involved, and when I talk further about things like the value of piloting your project, and also things like internal grant reviews before you apply, then you'll realise how much time you need. And I've put an asterisk next to ethics submission 4 months out. That would probably be the latest that you should be putting in for ethics. And you don't have to have ethics approval before applying for funding, but they generally won't release funding until you've got ethics approval. So it's good to at least have got it in. But if you've already got ethics approval, that strengthens your application enormously, and often you've been through a to and from process which has made your application better, easier to understand and more convincing. So it's a really helpful process. All right, we'll talk about a few of those little time points further on. And I think it's worth going right back to the beginning. If you haven't got a clear question, it's very hard to write a protocol or a funding application, and it's really worth spending time on honing down your question, and that requires doing really good literature review. So they're never going to fund anything if you can't demonstrate understanding of recent developments in the field. If you're applying for funding for new data that's just been done, that's not going to look good, and a good panel will know that. So you should be speaking to other content experts as well, and all your relevant key stakeholders. And as I said, understand what makes an idea worthwhile. When is it good to do? Not just because it interests you, and not just because it hasn't been done locally if it's already been done interstate. There's got to be a really good reason to do it. And a really simple starting point is that basic evidence-based medicine tool, PICO. So PICO describes the 5 things that must be in every question. So describe the population, the intervention or indicator of interest, the comparison if there is one, the outcomes you're interested in, and the time frame. And once you've got those 5 things into your sentence, then you can start drilling down into the detail of each. How am I going to select my patients or my population? Where am I going to sample them from? All those other things. So assuming that you do have a good and worthwhile and clear question, as I said, the more time you spend down the front end, the more rewards you will reap later on. And that goes right through to not just developing the question and doing the background review and the methods. Pilot testing is really important. So if people have reservations about how feasible your project is, if you can demonstrate that you've already done it on a small scale and everything worked, and you've generated some data to underpin a proper robust sample size calculation, etc., then those reservations disappear. So sometimes it's really worth applying for a little tiny grant first to do a pilot project. It can really strengthen your application. And of course, whilst you're writing your funding application, many of the things you're writing about would also fit into your study protocol, so you should be writing that at the same time, as well as doing all the logistic stuff, so getting approval at the sites to do the work, putting your ethics application in and making sure that you're going to be able to get the resources you need if you get the funding, and maybe you'll be able to get some of them in kind, and pilot test if you can already. So as I said, before you write a single word, make sure you've read the funding agency applications word by word and follow them exactly. It's also good to find out roughly what the median funding level is. So you may as well aim high, but don't aim ridiculous. If the average funding level is $5,000, don't ask for $500,000. That's fairly obvious. And as I said, speak to people who've been successful at that funding agency before, or speak to people who've been on their panel before. So someone who's recently been on a panel is often very helpful in saying the sorts of things that they're looking for, or the sorts of things they've just funded, or the sorts of things they're not planning on funding in future, etc., etc. It's quite reasonable to go and have those discussions. So as I said, you want your application to stand out, and you want it to be great to read, and do follow the recommended layout. I mentioned appendices before, so some do allow appendices, and by all means put your data collection form in there, for example, but don't put a whole lot of vital information that would otherwise not be read if they're only reading the main application, because they might not get to the appendices, and especially don't put appendices in if they're not allowed. Don't bother submitting late because it won't be included. That happens all the time. And do trial run your application in advance. So many applications are now done online, and it can take a lot longer than you thought. And if you log in 2 hours before the cut-off point and everyone else is doing the same thing, you might have enormous trouble getting it done in time, or attaching things, or whatever it is you need to do. Sometimes there are 10 attachments and lots of cutting and pasting, but do have a trial run early and just get a feel for how long it's going to take. And also anticipate criticism. So there's nothing better than heading problems off at the pass. So presenting your work to your peers, and if they say, well, what about X, or I don't understand that methodology, then the chances are that someone on the panel might not either. So if you're about to use some unusual methodology or some strange new test that people haven't heard of, or you're heading down a pathway that nobody's ever done before because that's not the current thinking, you need to convince them why it's important that you do it in that way and explain why you've made those choices. And that will hopefully get you over the line. Right, let's talk about a few of the specific headings. And again, of course, they vary, and sometimes there aren't very many, but these are the sorts of things that need to be covered. And we'll talk about a few of these in a little bit more detail. So the title's actually really important, and I put up this very horrible NT News front page because I lived in the Northern Territory several times, and they have the worst paper in the country, but they sell more newspapers per capita than anywhere else, and that's because they have these terrible front pages that you have to hide from your small children and things all the time. So having something that sets a good first impression is important, and having all the key pieces of information that you want to get across in that title is important. So they don't want something incredibly boring and wishy-washy. Ideally you include the main outcome you're trying to find, and you might have a simple descriptor but a colon and then a very clear description of the method, like a prospective cohort study, and the particular outcome you're planning to elucidate. And never ever put abbreviations or acronyms in your title, because you'll lose people straight away because they won't know what you're talking about. Assume that people outside your field on this panel don't know your standard acronyms. It's really important not to put them in. Kills readability, and all the way through the application too. I mentioned ethics approval. It will be tied with funding release, but it's not critical. But do indicate what the ethical issues might be, even if you haven't applied for ethics approval yet. As I said, it's great if you can find the time to get the ethics approval done in advance, because it will make it a better application. And just like a review panel, an ethics committee will have lay people, it'll have legal people, it'll have a whole range of people on it, and if they understand it, then chances are the panel will get it as well. As I mentioned, the summary is the most important section. So it might be quite short and it might be the only section of your whole application that everyone on the panel reads except for one. So right at last, I think, when your ideas are clear and you've finished your whole protocol or your whole application, and come back to it and get everyone else to have a really good look at it too on your team. The organisation is really important, and I'm going to talk about the sort of logical order in a sec, but again, try and avoid jargon. You're embedded in your project so much that to you it all makes perfect sense, but to other people it might not. And even acronyms that are in this hospital won't work in other hospitals in the same city, so let alone interstate people who might be on the panel. Try and hark back to the objectives of the funding agency to show them why this is relevant to them and why it's important and why it should be funded and funded now. And try and keep it short, always succinct and objective. So I think the best approach for the summary background is to just hit people straight up with what the problem is and why you are applying for this funding at this particular time. So as I mentioned, you need to be across the literature, but this is not the place to bring it in, but you need to summarise what the knowledge gap is, what the current state of play is, and why this is such an important problem. So you're trying to generate knowledge to fill that current gap, to take the next step. And there has to be a very clear justification in terms of impact, both short-term and long-term, and a very clear statement of the research question. Sometimes in the background there's room to give an overall methods approach, like I'm going to do a randomised controlled trial or whatever it is, and the expected outcomes that you're going to find and how you're going to measure them. So the sorts of things under significance sort of fits in with all of this, and it might be a separate section, one of those ones I said where you feel like you're repeating yourself, but always write it as a standalone section. So you need to convince them that this is a problem, that it's an important problem, that you're generating new information that is also important, and then what are the benefits? And do think outside the square. So yes, always impact on health is important, but maybe there'll be economic benefits. Maybe you'll be training up a whole new workforce and capacity building. Maybe you'll be impacting on policy or improving collaborative networks in health and enabling possibilities for future research and funding. Maybe there'll be new intellectual property or commercialisation opportunities. And maybe you'll be building greater ties with your community, which is really important. And of course, again, fit with the research priorities of the organisation and really explain why the funding is needed at this point in time. And then they might ask again for aims and objectives, and you'll think, well, I just did that, but just do it again, but frame it very carefully so that they exactly match your research question. They've got to be really precise, and you should have one primary hypothesis, and then in logical order, the next, if there are secondary objectives, they should each build on the one before. They should all be relevant to that primary question in some way, and then you build your methods around that. And as a clinical epidemiologist, obviously for me methods is the most important bit, because if I don't think you can do it and I think you haven't thought about all the things that are involved, then I'm not going to think it's a good application. But often this is quite a small section, so you have to be very careful to get the information across but not take up 3/4 of the application. So we need to know the study design and why you've chosen it, because there's often more than one approach possible. You need to know why you've chosen the setting that you have and why you've chosen the participants. So where are you going to select them from? How are you going to sample them? What are the inclusion and exclusion criteria? How are you going to recruit and consent them? All of those things are relevant. This is where you've got to put all your definitions of exposures, like risk factors that you're interested in, for example, or outcomes that you're going to measure, what tests you're going to use, particular lab equipment, or particular investigations. By all means, include your data collection plan, usually as an appendix, and you might be required to put in a data management plan, If you've got pilot data, definitely put it in, so that will be very convincing. And have a statistician have input to your analysis plan and justify your sample size. So that's where the piloting can be really powerful, if you've got some real data. This is also where you outline any ethical issues, or just say, I've already got ethics approval. Terrific. You might be required to put in a monitoring plan if you're doing a randomised control trial. And this is also where you have your timelines and explain what your community involvement and communication plan is going to be. So it's a lot of things, and some will have greater priority than others, and depends how much space they allow for you. And I just wanted to spend 1 minute on study design, because as you go higher up this pyramid, it's a stronger study design because you reduce bias and you increase the ability to prove something is due to something else. So ideally we go the highest up this pyramid as we can, and we do a randomised control trial, but that doesn't mean you can, because it might not be ethical or feasible. So consult with people about what the options are for your particular question, because certain questions lend themselves to certain designs, and then you have to balance up what you can do and your resources with what the best design might be. And the main thing is explain your choice. So my first ever NH&MRC application used a methodology called case cohort design, and we had to go to great lengths to explain what that was and why we wanted to do it that way, because we knew most people didn't know what that was. And it was the best method for us, but without that explanation we would have had a lot of trouble, because it's not a standard design. And there were other designs, so it's just one example. So I've talked about why piloting is great if you can do it, and obviously it's going to increase your chances of funding. And I think this power of providing actual data that can help you estimate your sample size is really important. But as I said, if you can reassure the panel that you've already done this and you've ironed out any potential problems and you can recruit where someone thinks you couldn't, then those reservations just disappear. And it's also a great way to improve your data collection variables and all of those sort of things. Analysis plan, really, I would recommend getting input from a biostatistician or an epidemiologist, but the bottom line is that you should just collect the data you need to answer your objectives, and don't make extra work for yourself, because that just all costs more. So if you can keep things as short as possible to answer the question at hand, you're going to have a higher response rate from participants, and you'll still be able to answer all your objectives, and you will have saved money. Just keep always going back to your study design and your study question and whether you've got all the bits of information you need. And do get advice, because there are different statistical tests that can be used depending on your design, and you might not even be aware of some of them. I'm not even going to worry about this, but it's logical that you would work through just simply describing the study population and then moving on to more complex analyses, and just a basic description of that is often all that is required. As I mentioned earlier, if you're doing a randomised control trial, you may well need an independent data safety monitoring board who look at data partway through in case there's obvious harm or obvious benefit, and it might mean stopping the trial early, because by definition this is an experiment. But if you're not doing a randomised controlled trial, you will probably still need to demonstrate regular monitoring of your staff and the quality of data management and so on throughout the life of the project. And it may even be that you already know you're going to be audited by an external sponsor, for example, a drug company, if it's a drug company sponsored trial, for example. Or sometimes you might get monitored internally. So many health service providers now in their ethics and governance office will have a compliance officer who will run around and check that you're doing the right things. So if you've got that backup, you may as well mention it in your application, and then they'll feel more confident that you're doing all the right things. timelines are incredibly important. So mostly to save space in a grant application, you would do a table like a Gantt chart, and you would have all the activities listed down the side and then coloured bars showing where all of these things are going to occur, and obviously many of them will overlap. It's really important to allow not only time from the very beginning, the study design and ethics, but right through to the end of impact on policy, writing up, communication back to stakeholders. All of that is part of your project, and if you don't put in realistic timelines, they'll pick it up straight away. The same with funding. And communication planning is really important, and if you can outline that, they'll sometimes request that in a grant application, how you're going to get information back through to participants through the life of the project and your sponsors if you're applying for funding, and other key stakeholders. And when you're applying for funding for people, it's really important that you are incredibly specific about why that person in that particular role at that particular level, what is their time commitment, why do you need that level of expertise, if you've got students, who's going to be supervising them, and so on. So without that very clear explanation, you could easily find that's a great place for them to cut funding from, even if they like your project. And site support I have briefly mentioned before. So really that's two things. It's having community engaged and getting letters of support from relevant people. But if you're doing actual data collection in various sites, you will need someone at each site to sign off as part of the governance requirements for getting ethics approval. And here in Western Australia, we either do that through a site-specific assessment form. So, for example, you're doing a hospital-based study and you need medical records to help, you need pharmacy to help, and you've got a ward that you're going to be seeing patients on. Then you would need each of those areas to fill in a site-specific assessment form and sign off to say they understand their implications, the time and resource implications of you conducting the research there, and they're happy with that. So you need to get those forms. The Health Access Request Form is an alternative if you're going to a site and you're not directly interacting with patients. So you might be just getting data from a lab database or putting up flyers to recruit people, and you just need to fill in that more simple form. So gathering that site support and demonstrating it is really important for the applications. So the budget is one of the toughest things to put together because many clinical people have never had to do this, and it's the last thing considered by the review panel. So they'll look at the merit of the project first, and then they'll look at the budget if they think it's going to get over the line. For you, you should work out the budget last, and don't let the budget drive the project, let the project drive the budget, because otherwise you'll leave out something important. And as I've mentioned, detail is everything. So it's all about justifying why you need that piece of equipment or that particular person. So it's not enough to say, I need that model piece of equipment because it's the latest and it's the best. That won't do it. It'll be more that it'll allow international comparisons, or it's the gold standard, or some other very clear justification. And there's no use asking for things that they don't support. So some funding agencies won't allow funding for people, for example, or they might only allow for equipment, or the other way around. So don't ask for things they won't fund. And as I said, for people, justify the level and exactly what it is they're going to do, or it's too easy to chop things out. So sometimes budgets get chopped by as much as 50%. So you don't want your most crucial person or your most crucial piece of equipment taken out. So be very clear about why you need it and how it relates back to your objectives. And of course, as I mentioned, if you can actually ultimately demonstrate cost benefit, that's going to be very powerful. So in terms of putting together a budget, you'll find that, for example, in the health system here on the research governance system, where we put these things in when we're applying to ethics, there'll be templates there for budgets, there'll be templates sometimes for funding agencies, but they'll never be completely comprehensive, they're just a guide. It's really worthwhile speaking to other people who've done similar research, because they might have ideas about the costs of different tests or different pieces of equipment. Definitely speak to your business managers about personnel costs and so on. And a budget needs to include everything above normal usual activities. So we do want to know, particularly in the public health system, the in-kind costs as well as the costs that are being requested. So they want to get across the total costs. What are you putting in and what are you asking us for? And there are a lot of things to think about. And I've just got 2 slides which are really lists just to prompt you to think about things. Because many of these get forgotten about and may not be in the template that's given to you. And some of the common areas where things fall down is funding for epi or biostats or data management support. People often forget about that. Database development, entering data, double entering data, analysis when you get stuck. But staff is probably the biggest. So remember that if you've got a long-running project, staff will move interstate or go somewhere else and you'll need to rehire and retrain. And staff have increments each year where the salary will automatically go up. And on top of that, there are big on-costs as well in health. They can be as high as 30 or 40%, and sometimes people forget that altogether and then get horribly stuck when they go to employ someone. And of course, professional development, all those things. So I'm not going to go through all the things on this list, but just so that you have a list to prompt you. And as I said, remember, piloting costs money or time or resources. If you can do it in kind, great, but you might be wise to apply for a small amount of funding to have a practice go first. And if you're working with industry, running a clinical trial, they will be the sponsor generally, and they will have to pay the clinical trials insurance and the ethics application fee as well, which doesn't apply necessarily if you're self-funding, if you're not working with the private sector. Okay, impact we've talked about a little bit already. But some other areas that you need to think about are capacity building, so workforce development, you're training people, you're leaving something behind in communities, or you're mentoring people up, or capacity building. And then other things like commercialisation or leverage for future funding is really important as well. So it's quite often that when you finish a project and you generate these data and you come up with your answer, that there's a logical next step, and sometimes you know that's going to happen even in advance. So it's really worthwhile doing that. And many funding agencies now work on the premise, we'll give you this much if you can raise the same amount. So you need to be aware of having your irons in more than one fire. All right, references are part of applications, and make sure they're accurate and you've used EndNote or a proper package and that it's actually turned out all right. And do think about reviewers, because sometimes panels will also bring in other people and they might even look at your reference list, so be careful what you reference. And then in terms of the submission, I would recommend really polishing before you give it to someone else, because you don't want someone who's reviewing your grant before submission to get lost in typographical errors and bad grammar, because that's just distracting them from some major fault potentially in your application. So do put effort in first, and then you need to give your draft to a range of people, so a content expert and a non-content expert. Someone who can edit and someone who's really, really honest, because the worst thing is that you give your piece of hard work to someone and they just go, I thought that was great, because that's not really very helpful. It might be great, but there's always something you can do better. So you want honest people and get all the relevant stakeholders involved, especially the community, the end users. So community involvement is critical, because you'll find a lot of your words are too big or don't make sense, or you haven't measured something that's actually really important to the end users. And allow enough time, which brings me to this. So most places now, such as hospitals, research institutions most definitely, will have internal review processes, and that's now started here at CAHS just this year. And it's really important because it allows institutions to make sure that they know what's going on under their own roof. It ensures quality, and they may not want 50 applications swamping one grant opportunity. They might only want to put up the ones that align with their priorities and that they think are the best. So it is a quality assurance system in a way, and it also allows all of those things I've just mentioned. And without that letter of formal endorsement, you won't be able to apply. And here at CAHS, there's a minimum of 2 weeks, but for something like an HMRC, it's a much longer process than that, and it certainly would be at Telethon Kids as well. So be aware, wherever it is that you work, be aware that there may well be an internal review process, and make sure that you've got everything ready in time for that, or you won't have that letter of endorsement and you won't be able to apply. I've already talked about detail, but check it all again once you've got that endorsement and before you put it in. Dot every I, cross every T, so you get through that first pass. And very rarely, but just occasionally, you'll be asked to respond to a question, as I mentioned, and just keep it brief, be around, be aware of when these things are going to happen. Don't be on holidays or delegate to somebody else. And if you're successful, fantastic, and then comes all the work. And remember the obligations to the funding agency, which is often forgotten, which is not good, and they won't like you next time round. But make sure you've got your ethics approval, and there'll generally be requirements to report back to the funding agency through the life of the project, and especially at the end. You may be required to give presentations, and you'll certainly be required to acknowledge that funding in any publications or presentations that you make, and immediately notify your comms team, who will jump up and down with great excitement. They don't want to hear about grants 4 weeks after they've happened, because it's old news. Everyone works on a very, very short news cycle now, so if you've been successful with a grant, your organisation will want to know and let your comms team know. And if you're unsuccessful, don't panic. Most people aren't first time round. And if you look at that 20% success rate for NH&MRC, successful researchers don't give up at that first knockback. You just have to keep going. So you will have got some good feedback, hopefully, and you can fix your proposal to be even better next time and have it ready to go for the next funding round in the same place, or go look for somewhere else as well. But it's certainly not unusual to get knocked back. It's a bit like trying to get papers published. So in terms of take-home messages, there's a lot around grants, but do take time at the front end of a concept being developed, and get a really clear question and make sure it is worthwhile, not just to you, but to the broader stakeholder group. And putting that good team together is really important, and try and collaborate outside your own little world. It always ends up in a better application. There are lots of funding opportunities out there, so make sure you register and do find the right source of funding. Try and pilot if you can, try and get ethics approval if you can. Try and suss out who's on your panel and what they're looking for, and understand how their processes work, and learn how to write well, because that will make a big difference, and certainly get other people to read it, and get lots of input along the way. So that's all from me. That was a bit of a whirlwind tour, and it is very general because there's no two grant applications that are the same, but I hope that's given you a few practical thoughts around grant application. And as I said, there's loads of website specifics in your handout about where you can go look for funding opportunities, and you can explore each of those when you've got time. So we've got a couple of minutes for questions or comments. Does anyone have anything they'd like to ask or comment on here at PCH or off-site? I've probably bamboozled you. And down here.
If you have I work in the Department of Anesthetics at CAHS Research Hospital.
Mm-hmm.
The department's recently becoming,
Sorry.
Sorry, I work at the Department of Anesthetics at Sir Charles Gardner Hospital. Our department is recently becoming involved in research. A lot of the ideas come from clinicians and anaesthetists with a lot of clinical experience and no research experience. What would you advise people like that to do for an application?
Yeah, that's a really common scenario, and obviously we want to really support people who are new to research getting through this process successfully. I mean, ideally you would, with any project, you would bring in at least one person who has got some research experience, and I'm not sure what's available at Charlie's, but increasingly there is direct one-on-one support for research. We certainly have that here at CAHS now, but it's relatively new for us to have that level of support. Certainly try and start relatively small in scope if there's zero research experience, but having said that, you can jump on board a multi-centre randomised control trial if you can jump through the hoops to get you good clinical practice training and buddy up with someone who's done it before. So I think it's all about putting the team together. So just try and find one person who's got good experience in the area. It makes the world of difference. And I know you've got an ethics and governance office over there, and there are often people embedded or related to that unit who will provide advice one-on-one as well. But yeah, look, it can be particularly hard in the clinical world. But we've certainly been working hard here to support people with everything from audit right through to the pointy end. And I'm starting to see a lot more of that in other hospitals too. And I think on the positive note, universities are now really embedding research skills training in their undergraduates, so that people coming out qualified are already research ready, and the rest of us who are already qualified need to try and catch up. But for example, all of our research resources are available online all the time, so you can easily work through some of the basics there. But I'm sure that most hospitals will have people through their ethics and governance office who can provide some advice. And if you can't find anyone else, I know you've got statistical support. So bringing a statistician on board makes a huge difference because they're very good at study design as well as all the data side of things. So bring them on board, make them a co-investigator. That's the best way to get a strong design and strong analysis plan too. Does anyone else have a comment or a question? I'm very happy to stay behind if anyone does and they're feeling shy, but for those of you who've come along today, thank you for coming, and I hope even one thing was helpful. It is a really big topic, but do go back to your handout and you'll find lots of resources embedded in the back there. And thank you also for taking a moment just to tick the boxes, and if there are things we didn't talk about today that you would like to see covered or things that were just deadly dull, do be frank and we'll take that on board. So thanks for coming.